If you don't have a vaccine, you may not be able to travel to certain places. You may even lose your job if your company requires them and does not give you the federally protected accommodation. And now in some people needing transplants are being denied a transplant if they don't get the shot.
It's being reported in Colorado, but what about those needing transplants in Texas? Houston's only full-time TV health reporter, Haley Hernandez, joining us now with the answer from local hospitals. Haley?
That's right. So the Colorado-based health system, UC Health, is requiring transplant patients to get vaccinated against the coronavirus in almost all situations, citing studies that show these patients are much more likely to die if they get COVID-19. But this is a contentious subject because these patients may also die if they don't receive an organ transplant. So I asked our Houston hospitals if they plan on doing the same thing.
In Colorado, a hospital is in the spotlight after patients claim they've been given a deadline to get the vaccine or be bumped off the transplant waiting list. One of them on that list spoke with our sister station in Denver, saying she's not comfortable getting the shot and doesn't know where to turn.
I don't want this to be hinged on my freedom of choice being taken away from me, and that's what I feel is happening here.
So I asked Houston Methodist, UTMB, and Memorial Hermann if their transplant centers would implement the same policy. Houston Methodist essentially saying no way, adding, "We do not have a policy like this in place. Most of the COVID-19 patients who received lung transplants here got sick before the vaccine was even available to them." Memorial Hermann did not reply, and UTMB comments, "We encourage our patients undergoing transplant to protect themselves by getting vaccinated pre-transplant, as post-transplant immunosuppression will reduce their likelihood to mount good antibody response. We are not denying anyone to get evaluated for transplant based on vaccination status. Vaccines to prevent illness are already recommended, if not required, for these patients, flu, pneumonia, and MMR, for example."
And once someone receives a transplant, they'll be on medication to basically strip away their immune system so it doesn't reject the transplanted organ. That's why UTMB says it's best to get the COVID vaccine and build an immune response before you may receive an organ transplant. Lauren?